Reciban un afectuoso
Good
saludo.
morning, everyone. We welcome you to this session of the Inter-American Center for Social Security Studies, in which we have here our Executive Director, Emilio Carrasco, who will follow this session with this group of experts who will share their experiences for the effect for COVID-19 in the social security systems and also in occupational safety and health systems. These sessions invites you to review some other effects of the COVID-19, and also all the other effects that are not evident right now, and we know that it will be present in the future. The pandemic should have a profound impact in the Americas. This pandemic has provoked a great number of health deaths related to occupational risk, and it will be follows to the limit resources that we have before this pandemic. In the labor market, the pandemic also caused an interruption into some industries, which enables to less production. The number for employees were less for these conditions. When the region is started to recover, it is important to guarantee the strength for social security systems and also health systems to protect employees and also for general population to prevent future lockdowns. This is something that it has needs the application for the provision for some additional resources for the formation and training for preventative people, for the people who are exposed to these conditions. Additionally, we have to follow the entrepreneurs that to adapt these needs or these capabilities to entrepreneurs, and also for the governments have to work to guarantee that workers can have access to system protection systems, and also to information and resources for the training and necessary to be protected. Social security institutions can play an important role to improve safe and healthy systems before COVID-19 pandemic. And also it can be extended to other type of diseases, infectious diseases for the ones that we already know and the future ones. It is important to be able to the access for the health systems and also to provide financial assistance for the employees who cannot work. And also protection social security systems can teach how to reduce the risk for this occupational risk, also to provide information about the hygiene and social distancing to help to mitigate possible effects and prevent future pandemics. Finally, the protections of social security protection institutions can protect employees who were affected from the pandemic, for example, to protect social security and mental health. However, this topic, each of our panelists will talk about these topics, and they will suggest the ways that we can encounter this problem for future pandemics and also for the problems that the pandemic that we already are facing. Thank you very much for your attention. I'm Javier Garcia, a specialist from the Inter-American Center for Social Security Studies. We go next with Dr. Emilio Carrasco. Thank you very much, Javier. Thank you very much, our panelists, and all are very welcome here. The sense of this session is to have a casual and yet specialized exchange about a specific theme around certain topics and interest. I would like to welcome all panelists, to Dr. Karina Mena, Ann Tenier, and our engineer, President Engineer Ann Tenier. As you can see, this session has aimed to have a speak or a short a specialized exchange for the specialists who will provide us more information about this topic. And also, I would like to I will let Dr. Garcia to have the presentation for all the speakers that can be part of this session. I welcome to all these assistants and also experts for this presence, since we are set, which have a aim in common, especially for the social security and the occupational risk. I also want to mention, as Dr. Garcia mentioned before, what are the challenges for COVID-19? But also, we have to highlight that we have learned a lot from this pandemic. And we have many important things that we have done before this COVID pandemic. There is a coincidence here that there will be future pandemics. We will probably have more crises, more diseases or new diseases. So we can see here that the pandemic has not stopped yet. It's been producing or has more effects in general to have more effects. So we have to think what we're doing for the future. This is the main sense for this session. We will talk about some specific topics with the specialist and also for our friends and our population in this session. In this talk, it will be a short talk with experience as friends who have a common interest. Thank you very much, everyone. And next with Dr. Garcia, who will open this session. And then we will exchange ideas and opinions about what are the purpose of these kind of sessions. Thank you very much, everyone. Thank you very much, sir, for your speech. Before we start this session, we will allow our speakers who can share the perspective in what is the situation of the COVID-19 or the situation in their countries. So we will start with Dr. Anne Tenier. She was appointed president of the Canadian Centre for Occupational Health and Safety in 2018 and brings a wealth of leadership and experience in environmental and safety management, community engagement, and government relations. Prior to joining the Canadian Centre for Occupational Health and Safety, Anne worked in environmental affairs at Manufacturing and Transportation Organization. She also holds positions with several professional and community associations. Welcome, Ms. Anne. Go ahead, please.
Thank you very much for that kind introduction. Really appreciate it. Let me just hold on for 2 seconds here. There we go. Really appreciate the opportunity to speak with you today. And the question that was asked is a very interesting question. What lies ahead after COVID-19 for occupational health and safety systems? So in some respects, this is a question that can be approached from what have we learned perspective. So with that in mind, I'd like to start out with this first question. What would work look like? Is there a new outlook on the workplace? So let's start with organizational leadership and culture. Dr. Julian Barling, in his recent book, Brave New Workplace, noted the following. We should be fulfilling people's needs for the 7 interrelated characteristics, namely quality leadership, autonomy, belonging, fairness, growth, meaning, and safety, as these are keys to productive and healthy and safe work. So a central idea of the book is that small changes make a big difference in the long term, especially during the most trying times. And that small changes in the 7 characteristics are enough to achieve productive, healthy, and safe work with effective evidence-based interventions presented to document this. Underlying each topic is the idea that we can achieve more by changing work rather than trying to change people. And I will also note that this is one of the very few organizational leadership experts who has recognized the role of health and safety as integral to organizational success. We should also focus on creating environments in which employees can flourish rather than relying on the resilience of workers to withstand difficult working conditions.
Miss Anne,
Let's ask ourselves, what
Miss
is
Anne,
right
can we
for
wait
not
just a minute?
employees or management? If there's one positive from the last 3 years, it's that the pandemic has brought well-being to the forefront of the conversation, says Jack Dinnerline, adjunct professor of ergonomics and safety in the Department of Environmental Health and co-director of Work Health and Well-being, Achieving Worker Health at the Harvard
Miss Anne, can you hear me?
School of Public Health. And I can post this reference in the chat. He went on to say, now all of a sudden, people realize that the impact of work has on mental health and other aspects of well-being. Through impacts like reliance on childcare and disparities in work, the conversation has changed. So, second point, don't forget the basics. Workplace have legal responsibilities such as having a health and safety policy, regular inspections, supporting a health and safety committee, incident investigations, etc. So get restarted on the right foot and make sure that these core activities are in place. But also recognize that your workplace has changed, no matter whether you remained in the workplace during the pandemic or whether you worked remotely and are now returning to a hybrid workplace. Infrastructure, work processes, technology, social supports, all of those changed over the last 3 years, so it's very likely that your health and safety processes will likely require some adjustments as well. Now is the time to adjust how work is done while you're reestablishing your routines. And recognize that not everyone will feel the same way about returning to the workplace. So we need to address return anxiety. So for those who had the ability to work remotely during the pandemic and are now returning to the workplace, experiences can vary among workers. Some workers may be very excited to return to the workplace, while others may feel increased levels of stress or experience return anxiety. So return anxiety can be addressed before, during, and after the return to work transitions. Employers who are flexible and understanding can help ease that transition. So in the audience, I don't know how many represent workplaces where remote work is happening. Perhaps you can indicate that in the Q&A along with which sector you represent. So the ways in which you can address return anxiety, here's a few ideas. Identify, monitor, and control workplace stressors. Continually assess the workplace to identify and address psychological hazards. Engage health and safety committees and representatives to seek feedback from workers. Communicate changes in advance. Be open and honest with workers and communicate any changes in health and safety measures that will be implemented. Train and educate leaders. Provide leaders with the tools and the resources that they need to foster a psychologically safe and healthy workplace. Make sure that managers and supervisors know how to recognize psychological hazards and how to address return anxiety. Check in with your workers. Make sure that managers and supervisors understand the importance of checking in with their team. Having frequent check-ins can increase positivity, foster trust, boost psychological safety. These check-ins will in turn support workers' mental health and workplace well-being. And don't forget to check in on your managers and supervisors as well. They also need that support. Ease back into the workplace. Moving too fast may be stressful for some workers. Plan a gradual return to the workplace to ease anxiety. Provide mental health support. Workers may seek mental health resources as they return to the workplace, so make sure employees know how to access support, such as employee assistance programs. post-contact information for local and national mental health support groups, organizations, and programs. So again, in the chat or in the Q&A, I'll post a resource that our organization has produced that might help with supporting your return anxiety if it manifests itself in the workplace. Now, it was mentioned in the introduction to today's session about potential for further pandemic. That's entirely possible. So we need to continue our infection control programs. The COVID-19 pandemic has shown that diseases can have a dramatic impact on businesses and organizations. Employers should consider incorporating infection control measures into their health and safety plans and their business continuity plans to reduce the impact of these types of outbreaks. Infection control measures are a set of principles, practices, and procedures designed to prevent people from becoming infected with diseases and to control the spread of disease if an infection occurs. So for infection control measures to be successful, it's important to understand and to assess how infectious diseases can be transmitted in the workplace. So strategies should involve implementing multiple layers of controls to prevent the spread of infection. So elements that should be considered include assessing the risk of infection associated with specific tasks, establishing effective hand hygiene practices and respiratory etiquette, implementing appropriate engineering and environmental controls, such as adequate ventilation, adopting good administrative controls, including the development of workplace policies and procedures, worker training, measures to ensure sufficient staffing, providing appropriate personal protective equipment, and making sure employees are thoroughly trained on the proper use. Again, we've got a resource that might be helpful that we've produced at our Canadian Centre for Occupational Health and Safety, and I can post that in the Q&A or the chat after my remarks. We continue with all of these processes in our workplace, and it's become second nature to us. Next, I would suggest questions to ask about the changing organization of the workplace and the role of hybrid work. Many of you may be working in a hybrid situation where some of your staff are at home, some of them are in the workplace, and you straddle both. When it comes to the role of hybrid work, really look at what your workforce would prefer. A survey done by Statistics Canada in 2021 indicated that employees with a high school diploma or less would prefer to spend 9% of their working hours at home. On the other hand, those with at least an undergraduate degree would prefer to work from home for 44% of their total hours. So what happens to the many benefits from the sense of autonomy when large-scale corporations tell staff they have to work from home for at least part of the week, or they introduce electronic monitoring of remote employees? What does informal socialization of newcomers look like in an environment of remote work? In addition, how will organizations support remote employees who simultaneously care for children or elderly parents or relatives? Does hybrid and flexible work hours mean the same thing? Does working from home enable more people to join the workforce? It could be some opportunities for persons with disabilities and those who live in remote communities. They may have more opportunities for employment. So I'll post another link. There's a number of good resources in researching this particular topic that we came across. Now, let's not forget about the introduction of new technology. And I'm not just thinking about those technologies that enable us to work remotely, but also artificial intelligence. Technology is another aspect with artificial intelligence, machine learning, holographic imaging, and the Internet of Things, bringing the potential for rapid workplace innovation, but also job obsolescence and the need for new skill set. For example, analytic tools allow employers to manage logistics and anticipate consumer demand, thereby restructuring production flow, enabling last-minute adjustment to worker schedules. Consequently, Workers may have less predictable and reliable schedules, complicating their ability to balance work requirements with competing demands from family, caretaking, or second jobs. Automation increases productivity and output and creates new jobs, although these jobs are not necessarily evenly distributed by sector, gender, or skill level. New technologies may also result in changes in job quality and displacement and increased competency obsolescence, resulting gaps in skills may increase the need for continuous education and training of workers. Again, I've got a great resource for that. So the Great Migration, welcoming newcomers. We're in a period of intense global migration as a result of many factors, whether it's economic, climate change, political unrest, war. Here in Canada, we're welcoming some 500,000 new immigrants to Canada over the next couple of years. So welcoming newcomers into the workforce will present special challenges related to language, literacy, skill level, trauma, and many other factors. So are our occupational health and safety systems ready to welcome an influx of immigrants? I think we also need to consider in the future world of occupational health and safety the intersection of diversity, equity, and inclusion on occupational health and safety. While our workplace health and safety systems may have evolved to address technological change, do they adequately address the needs of diverse populations so that workers feel included and have equitable access to prevention and protective measures? As a relatively simple example, does your personal protective equipment adequately protect women? Is it sized for women's bodies? Is it available? Do we consider racial, gender, and cultural diversity in our occupational health and safety systems? What about Indigenous people? Do we incorporate valuable Indigenous learnings in protecting worker health and safety? So there's a growing body of research that's also demonstrated that conditions of work, including job insecurity, high job strain, and contribute to inequalities in lifespans, as well as other poor health outcomes, such as cardiovascular disease and accelerated cognitive aging. This burden of work-related disease may have implications for economic performance, contributing to economic and political instability and potentially discouraging investments in new jobs. As we know, working conditions are significant social determinants of health and well-being. And we can't forget climate change. We need to start thinking about the future to address disruptions. They can't be fixed by one sector itself. It's a collective, and we're going to need to work as a collective. This includes non-pandemic issues like climate change, respecting biodiversity, preventing habitat destruction. It literally has an impact on our workforce. We need to think about infrastructure, capacity, and structural change. Again, the Harvard's T.H. Chan School of Public Health has an excellent paper on that, which I'll post in the chat. Has the intersection of climate change with workplace health and safety been considered? And if so, have you considered, what have you considered to be the major impacts on occupational health and safety? Are climate change impacts considered in your business practice? Have risk assessments been updated to reflect impacts of climate change on all aspects of workplace health and safety programs? What are the key questions to consider in those risk assessments? What does a climate change layer look like in psychological health and safety risk assessments? Your challenge as occupational health and safety professionals is to look at the hazards that you've already identified in your workplace and ensure that they are viewed from a climate impact lens that takes into account scenarios specific to your workplaces. And as we start to introduce mitigative and adaptive technologies into our workplace, let's not forget to review risks to workers early in the design stage. of introducing those technologies. And finally, we know there will be economic benefits as components that are critical to our response to climate change result in new manufacturing opportunities. Here's the opportunity to build in worker protection into those new manufacturing or other processes. Your risk assessments and hazard prevention plans have never been more important as we transition to a climate responsive economy. So hopefully these thoughts have provided some insight into what we may be facing as occupational health and safety professionals in the not too distant future. So I want to thank you for the opportunity to participate in this panel and turn it back to our moderator.
Anne, muchas gracias. Doctor Javier, por favor.
Muchas gracias.
Thank you very much, Ms. Anne, for your participation.
Thank you.
We will go back with a questionnaire session at the end of the session. So we also invite our guest that can write their questions in Zoom panel to continue with our next panelist. We will continue with our next guest, John Marulanda. Let me just read about his history. He's a surgeon by the Pontificia Bolivarian University. He's a specialist in nuclear medicine by the National Institute of Cancerology for the Pontificia Universidad Javeriana in Bogota. He has a master's degree in health economics and health management by the University of Barcelona. He has been advisor at the Corporation for the Development of Social Security. He's an advisor at the think tank of the National University of Colombia, observatory consultant at Jorge Tadeo Lozano University, and also he's an advisor at the Ombudsman Office in Financial Criminals in Health and Monitoring. Since 2021 and currently, he has developed his study development of Social Security specialized advisor. And also from 2001 to date, he's university undergraduate and graduate full professor. We welcome him. Jan, please go ahead. Good morning, good afternoon, everyone. I'm pleased to be here with you. Thank you very much for your invitation from the CIESS and CIESS Subdirector, Roberto Sierra. So I will go ahead and start with the presentation. The objective is the study that the University of External de Colombia done before for what are the impacts for the COVID-19 after occupational and safety health systems. And Dr. Emilio Carrasco knows about a lot of this information. And the effects about the COVID-19 pandemic. We had many surveys about these topics, and what we are going to present right now is to present a series of recommendations of what will be the future for occupational risk and the effects that the COVID-19 done before. So just a presentation for the corporation. We are a company who done Social Security works for the contribution for population well-being. Within their objectives, there are three important topics: research, disseminate, and training people, and to promote the Social Security and protection, human protection, for the strength for Social Security. In this case, that we are developing some studies that has to do with health, occupational risk, and pensions. At this time, we are very attentive for the regulations that are presented in the country. As I mentioned before, our main objective is to provide the Social Security studies. The general occupational risk safety system, some of the main characteristics that can highlight here for the different panelists during research is the capacity to coordinate and articulate the prevention system and also for the first component for the Social Security through the instances that in our country we dominate a risk of occupational risk. This allows that the system can have a good response to the challenges that COVID-19 comes with to this pandemic. This economic existential evaluation has 6 main points. And also for the pensions, economic pensions that can, for the indignation or pension invalidity. As I mentioned before, these are some of the characteristics that somehow are fundamental for the risk response during the pandemic. We can see here a graph here of the corporation. We can see the structure of the general risk, occupational risk system. We have 2 ministers, occupational minister and also the occupational risk system. Work inspection, also a directorate for occupational risk, and the Minister for Health, for a Minister for occupational risk, and also the employees, the superintendency of financial superintendency, in the national health superintendency. This is something that we can relate, as can you see here, is some occupational risk systems within the social risk occupational system. The cost of the pandemic in Colombia, just to mention some figures from the Externado University from Colombia, it shows that the Colombian economic have more than 15.7 billion in comparison with the same period in the last year. The cost of the pandemic can secure the industry in 2.9 billion pesos. It means to $750 million from March 2020 and October 2021. It is also known for Colombia, but also for all countries. We were the most, we had the most impact for more than 52 years. We have also other information that will be a Facultad study, that is the security companies in Colombia. In the left side, we can show some elements that were provided for the security companies. For the security companies, these are not the function that the main function for the security companies to provide protection, personal protection elements, and also they provided respiratory equipment with more than $557 million in pesos. Sorry. We also have for the right side, we have deaths, and there were 788 deaths in professional in this health environment due to the activity that they made before or during the pandemic. Some other data. During this time, from June, there were 284,367 subventions for workers who were affected from the pandemic. For the 85% for the subventions were reserved for the people who work for the health and all other sectors. And the secure companies suffer more than 76 million pesos for the temporary incapacities. We can see here that in general, there are the impact that the insurance companies receive in terms of occupational risk. In terms of the study for the effects of COVID-19, we can see the following elements. There were two important effects. The first one, through the measures from the framework of the social security risk in general system, and the process for the prevention and recognition for the contingencies. These are the two main frameworks of this work. And also methodology, a documented methodology of quality, in which there were a documented review, and the surveys were made for the people who can decide from this process international and nationally. In this case, there were reviewed more than 15,000 articles published between 2020 and 2022. And these were resulting into 152 sources, which constructed more than govern regulations. As you can see here, there is very extensive work. There were interviews, structured interviews from these public entities, and also for the health and protection social ministers, other state organizations, as a delegate and the coordination for the health. And the risk companies were surveyed for the decision for them to know what are the situation for the country, and also for the company that work together with them. And also for the Colombian National Association for clinics and hospitals, as they can see actually for the process of the labor risk or the disease for these Colombian processes. And basically, these worker unions for the CTC and National Medical Federation. And also there were statistic data were consulted for the Minister and Superintendency, Financial Superintendency, and FESECOLDA, with the bibliography and also for the surveys that were done by many officials. And also I would like to talk about what are the contexts that we have to understand of what the risk occupational system was made for in the Social Security protection. In the Resolution 385 and the Decree 457 in 2020, it talks about the circulation of the workers that allows to develop their labor activities or their work activities. And also they talk about the Decree 417 2020, about the Republic President declared economic emergency, social and ecological emergency in all the national territory. And also for Decree 444, can give or provide more liquidity for nation when the effects of the emergency caused by the COVID-19 affected all the main liquidity sources. So I can see here that the context, there were a very integral management, and also for fiscal and also for all other risk environmental processes. These are some of the resources. Decree 814 also provide financial transferences, no conditional, additional, and extraordinary, just to finance to provide more information, more economic help for the direct schemes for the protection, social protection. And help for the formal employment. Some of the actors consider that some of these resources can protect the work from some sectors or other sectors or actors from the system. They gathered together that no all risk labor procedures were regulated, so there were a protective government to provide some resources for these employees. Just for topics, we can see here that there were less than 4.8 million of workers or jobs in between 2021 and 2022. So we increased to 20.3% the labor rate in comparison with less than 10.4 points percentages in 2019 that were developed in the first year for the pandemic. And also the risk occupational system in general goes down, and also for this rate goes over and goes up for the recovery rate that increased in important level in this 2022 year. In the Colombian economic in 2020, they explained that why in 2022 Colombia was one of the countries that have more increased rate in their economy. For us, a part of these region countries, we will have more financial or higher levels on higher numbers in 2023. Some of this information for the formal and informal work says that there were women were more affected than men. Women are probably to take care of household activities, which impacts the sector for market sector for the job. In 2022, just to stop these lockdowns, massive lockdowns for the financial processes for the woman. 2021 and 2022, we can saw that the rate increased for workers. On the other hand, the negative aspects of this show that there were more formal works, even though the rate of Colombian rate depends on the daily work. The general risk occupational system show that in the future they have more increasing rates for coverage for the formal work. So we can see how can we recover more than 50% of the employment that the country have. In social security access, the social security access was maintained in the formal sector, when in comparison with some numbers in social security, the billing of companies or the financial primes were provided, it cannot be done with the access for the work. But we can see here the informal works. As we mentioned, the collaborative economic, so we have to do more efforts in fight against these processes so people can have access to this system. There is a very specific topic here that the lack of coverage for occupational risk for all the informal occupational sector, they don't receive health. So there is no health protection, so they can have the rights for health. And there are many sectors for the health that are not formal, so they are basically responsible for the subsidy government because they have capacity for contribution. As you can see here, there is not very, we can clarify there are many people who cannot produce agreements with their workers, so they lost the jobs. They didn't have access of the contributive regime, so they can be attended or can be held from the subsidy term. The occupational risk systems presented an increase of the rate of affiliation in 2021, which goes up to 2019, a few years. This increase of affiliation was of 3% approximately in comparison with all the levels of the pandemic. The employers has to cost their incapacities or the insurance for workers. So they have to. So we have here nowadays the incapacity systems that have to be assumed for the employers in insurance from the day third, and for the next days. So here we can see a little bit about the protection for occupational risk. So it depends on the increase of the employment that started to really develop in 2021 from the economic recession. They can see that in 2021 we will have already 10,000 million employers affiliated to the system. So, and before we have only 10,431 million. So this is a reactivation, a very important reactivation of economic. In terms of COVID-19, the most important thing that was the declaration for COVID-19 as a occupational disease, direct in the main process for this topic. The morbidity rate for by disease, it was increased in 80% for workers before the pandemic. So we have here in a space here for health professionals who increase more than 80% for the disease recognized occupational diseases. So we can highlight here that this insured system in occupational risk can increase the mathematical reserves during the pandemic. So we have enough reserves to recognize the prestations for the economic insurance. So we have to have a supervision, important supervision or the diligence for this sector. The occupational system need to implement a secure area. So this is the second insurance branch during this area. Some of these are some of the data that how the confirmation cases has been confirmed before, since the COVID-19 is a labor disease. As you can see, there are less than 80% in 2021. These figures goes up the 14%. The incapacities term is one of the most important term here for the incapacities, which impact more for the sinistralities in this period. So also for the absence of regulations before these provisions, especially which was related to the periods of lockdown and the pandemic. So we had to offer or provide, for example, the personal protection elements that are not in charge of these responsible entities. So there are obligations. So due to the lack of compensations, there were no, as we mentioned, the sinisters or the diseases were not approached due to by other risk. 2019, 2021, there is the protection of the labor risk, where in 2019 we can see here that almost 80,000 occupational diseases. In 2021, we go to 82. Psychological occupational risk are increasing the risk of occupational diseases. It means that it is generated basically not only for the COVID, but it also have extension for nowadays. Biomechanical and psychological risk are still in these times. So they have not diminished during these times. The financial behavior of these occupational risk systems have presented more elevated figures. 2021, the 4% for the sinistrality has increased. So they have recovered, or they have increased in 3.7%. In this case, is we know about the coverage for the informal population versus the formal population. So in this point of view, it had a good increase in these percentages for the primes provided, and also for the mathematical research primes. And also we have two laws, 2088 and 2021, from household or the hybrid work, or work inside or work from home. The work from home adopted a temporal measure since a confinement, and also the agreement nature work conserved with the relationship with an employee and employer. And also for the remote work through existing technologies and the productivity for employees. And obviously, we have to look for a permanent work, since the transition can take place during that process. The remote labor can have been because some of these characteristics are very important, because they have to change from all the processes for the house for the remote process. And the remote work has to different criteria from the employers to know who can work remotely or who has to work on site. And some of them, they can be qualified for some occupational disease of this type of work modalities. In respect for these modalities, there is no clarification, and these are some recommendations that the study established. What are the responsibility limits for each people in this system in particular? So this is what happened with the employers. Also for what is in the limitation for and how the modalities of the employers are implemented. This is in the case where the employers diminished the direct supervision for the workers. There are more alternatives also for the information technologies and communication. The collaborative economic particularly refer to some platforms. So there are no labor upgrade. So it is considered that they are employers between the demands, who demands this kind of services. So this can be a problem in terms of they are not suffer the same risk, but the protection they can receive. So the system has to configure a new process for these collaborative reforms or provisions. So the employees can a special regimen within the formal scheme. So it can be a debate of the social security systems. Some of these recommendations that the experts provide, the risk occupational systems are very strong, and they can face all the critical years of the pandemic. For the coverage in the informal workers set. So it was proposed that other designed. There were 2 critical years, and additionally, this study recommend to continue study as reference what is happening in the pandemic to establish a great or strained framework about this. Coverage. The coverage was one of the main points during the coverage system. Some of the experts in this field said that this system plays or goes good for these informal workers, but informal workers, there are other kind of terms or other conditions. So is without effect the one we already have. You already have 5 more minutes. So we can see here other figures of faculties justify that this group, the sector has played good with this role. So we have the right graphic has a curve with affiliated workers, which is very important for the companies who affiliated for the general system. So we can see there is a continuous growth. There can be a breach in 2020 for due to the pandemic, but you can see here that it recovered the tendency for the next years. The new ways of work, there is a main topic that we have to talk in a different way. So the system is not prepared for these new modalities for remote work. So it means that there will be a new regulation or new provisions. The government has to analyze basically what are the consequences for the COVID for a population. So it is recommended to implement competencies or academic systems in health that were considered in the first line for the COVID as a occupational direct disease for the employees. There is an important element here that we have here the COVID topic and the sequel for COVID. And this shows that what are the employees who are selected and what are the criteria to go to or qualify to a COVID-19 disease sector. It could be, this was as decree. It was not established. There were more criteria for the process or traditional process for qualification. However, it can be presented more opportunities to face these benefits. The responsibility for the personal protection provision and also for attention for other pathologies for the pandemic. Finally, this topic of the COVID and some of the sequel for the COVID have to be included within the regulations that can be provided to set if there is a sequel or a modification of the disease. Occupational disease due to the COVID for the people who work in the health environment or the health field. Thank you very much, John, for your contribution. And so sorry for the interruption. And we would like to invite you to leave all your questions in the section here below, so we can continue to answer. So we can answer you in the correct time. We want to present the next speaker, Gina Chavez. She is doctor in psychology from University lecturer for 23 years. She's in research enrolled in the National System of Science, Technology, and Technological Innovation Renaissance of CONCITEC. She's member of the Science and Technology Research Institute in Cesar Vallejo University. She has published scientific journals and participated in proofreader in national and international scientific journals, as well as a speaker in science events. She was editor of the Psychology Journal in the University of Cesar Vallejo. She was responsible for the directorate of the School of Psychology at Cesar Vallejo Trujillo University. She has experience in research management and research and thesis project mentoring in graduate and undergraduate levels. She's member of the Inter-American Society of Psychology and founding member of the Latin American Association for Psychology Training and Teaching. And she has received recognition for her teaching performance and her role as journal editor, as well as her contribution in publications by the College of Psychology in Peru. Welcome. This is a pleasure to have her here, Ms. Dr. Chavez, that will present the perspective in Peru. Thank you very much for the invitation. Thank you very much also for the presentation. I don't know if I can share over my screen. Yes, go ahead, please. So I will present my slide. What are the experience in my country? So answer for the question, what lies ahead after COVID-19 for the occupational safety and health systems? So let me just introduce to be part of this context, as I referred before. For this, so we have to go back to the theoretic perspective. I imagine that some of these speakers know already that the theory for demands and resources. This has been changed during the time. It talks about, firstly, for the organizational field, there are labor demands. That is practically there are the physical, psychological, and social aspects or cognitive aspects that needs an effort from the employee. This effort, in some instances, can generate adverse consequence if, we don't have these personal resources that are also physical aspects or social aspects or psychological aspects that contributes to the development of the employee. So the employee can be motivated to perform their work. These labor demands and personal resources can allow the employee to do the activity with satisfaction, so that's why it can get engagement, also the burnout. These aspects can be have impact in health. But also for the last revisions for the theory, it is also highlight that this theory has an impact or demand an impact not only for the engagement or the development for the employee. And also the last investigations with the COVID-19 has allowed to know what are the permeability or the limits that are for the organizational field and familiar field. The theory also speaks that the reciprocal influence between personal and organizational aspects. And also the last researchers had said that the familiar resources had a negative impact in the organizational field. Even though we can, and as I mentioned, that is necessary for this presentation, a framework that this system is included and be part and interact and has influence from the cultural contextual they are in. So in this case, I will present some important topics in relation to how the pandemic have been affected. For example, in 2019, before the COVID pandemic, we already have a high percentage for informality. However, this percentage goes up in 2020 as 75%. In 2019, 7 out of 10 workers were informal. So they had bad consequences as we have the lockdown, or the person has had to go out the streets to look for the way that have to survive by the lockdown. And also in Peru, there was the suspension of work, the perfect labor suspension. This means that company can pause their activities or pause the employees and be provided for them by their salary. So it takes like around 6 months workers without being able to generate a salary or to have salary and to sustain their instances. So also the digital gap affected not only affected education, but also as, for example, in the rural fields, the internet connection was not possible. And education was provided by television. For example, it depends on the type of families. The father has to work, but the the kids had to study in the computer. And also, it takes part of the teaching field. For example, just to have to get all digital competencies in a fast way for the educational service. Apart from this loss of employment opportunities, there were also some other factors that affect the reality in the security, occupational risk, and health. For example, as there were no civic knowledge. So it means that some citizen that can now represent their representative, it can repeat the history. It's very sad that we already have been faced corruption in our governments in Peru, in our country. For example, people who just to get more financial ways, they can see other ways to work. So it affects also the economic of the country and social conflicts, as you already mentioned before from the news. And also for me, it affects the security and mobility also. So the thing that we have to go to work, it has affected the mobility. Some are aspects that involve the state and unfortunately also affect us. Also, some of the panelists, my friend Antonio also mentioned that they have been affected the health and labor risk health systems in my country. We have here the presence of a earthquake or also intense rains. For example, why? Because it can generate an exposition to dust that is very can affect people who travel. And also can be reported in some research how these climate changes have changed or have impact in the ways of how to get allergies or intestinal problems. And this can be perpetual for is if we don't have a prevention systems, because some decisions has been taken by corrupt people in the state. And also some other aspects that mentioned my Colombian colleague. I think that was my colleague Antonio, and the gap in gender. In my country, the pandemic also affected in terms of the labor positions in women. So she referred to the marketing. Also, they had been affected from this lockdown. And we will see next with some organizational aspects. They have had an impact in some other conflicts that are being seen in the employee. For example, to have to take care of the family or to develop some work activities that affect also the family. And also have been seen in the remote work. All of us know that the remote work showed immediately when we have to start a lockdown. It has been very frequent, or it's frequent that we can see in the news or on the TV that the digital connection between the employees and the employers. The employers contact the employers in very, very late, so they invade this environment from the employee. There were no opportunity to negate or just to not to do the work because due to the stress, and this generated stress and the lack of equipment also. And the companies have to see ways how to provide the equipment for the employees to work better. And the worker has to take their computers and to improve the internet services, not to have a short lunch or short rest. So there will be a change in the routine. So what are the times that they have to arrange in their daily task? The lack of a direct contact, also emotional impact, the conflict of familiar work. It was related to development of some activities and also the academic responsibilities from the child, the kids that are in charge from the women. The impact of mental health and the development of these activities, the behavior, interpersonal relationships, and also some companies apply this suspension that affect more than 303,194 workers. And also the burnout and the use of technology that we didn't use before, the use of a household people who work for other people in their daily task. And this combined with some other emergency situations in the maternity field that we saw before, specifically in the women, for household labors for women. In the familiar level, I can mention that the economic also implies for the labor development. So we have to understand the situation and just to establish a new plan that we will see next. And also to see about the familiar and the well-being of the employers and the organizations. And also deaths from the pandemic. And we have a large list for deaths. In personal level, we can see here that it's important if we want to enhance security systems in our work environments is to enhance the resources. As we know that they have an impact in the organizational field. For example, the efficiency, optimism, resiliency, and also the development of our some skills. When we develop some skills, so we can be more confident in how to perform some activities and the accomplishment from some goals. Emotional intelligence has been also reported. And I think that also the personality, as you cannot imagine this, also has a participation in this, in the work development. It can be seen that the experience contribute to the goal accomplishment and commitment. And also we have a study where it is categorized for three main reasons. For example, we have the narcissism, cavialism, and psychopathy. And no clinical aspects. These kind of structures of personality can be out of these moral cognitive aspects. According to this study, for example, not to use the mask, even though when the vaccination was not massive. So it represents a great risk in the health of people who exposed to others with the disinfections. This personality structure also have an incidence in participation in the organizational environment. So they have a behavior, they are behavior that are, go against of the organizational objectives. There were also consequences due to the COVID, as I mentioned before, where the mental health, burnout in teachers or the stressors, and also the commitment for that was part of this. So with this, so we have to answer for the question, what can we do about this? First of all, this year we have the remote law that was decreed 2 months ago. So there are some other organizations that they are developing remote work remote work. This is due to the emergency because there were no remote work previously. So we have to develop this information just to develop this work remotely. Nowadays, there are some organizations that already they are already modifying the modality for work in situ and into a remote work. So in this sense, we are just imply provisions to provide some equipment or have to pay for the bills for the light, for example. There are organizations that develop the work free from risk that can affect the integrity for employees. In one point, they declared that there are no risk for employees, so they can be provided with equipment, so just to not to have lesions and adequate all the environment for to develop the a good work or free of loud or sounds. So we also have a Supreme Decree that has to do where health and security in work. So this norm is applied just to contribute to not to for less number for accidents, trainings, auditories, and some internal inspections, and just to designate a security committee in the work that can accomplish with their functions and to have the necessary competencies to develop the work. And also periodical evaluations or assessments in different work environments, not only to know what are the risks that employees are exposed, but also to strengthen the capacities, to strengthen personal resources. As we have seen before, these personal resources can contribute to motivation and also prevention for the employee not to be exposed to risk in the workplace. It also has to do with some previous agreements. So in how, as worker, we can reorganize our roles in the work environment. So in this case, the worker can feel more commitment with this environment and just strengthening communication systems and also help for mental health. As we can see in the pandemic, this is a very important aspect. And strengthened leadership that can constitute a social help that contribute to social security and health for employees. Other of the aspects have to be developed are the evaluation to risk control. In this sense, there are a website, as you can see here on the screen, Sensopas CAPSA. If you can find here some publications from different countries that allow us to understand the scientific topic or how to identify the proof that can detect the effects in social risk. In the context of Peru, two of the dimensions have two items. Other the dimensions, for example, the confiability, the reliability. Some of them have adequate reliability. So in this website, they can be some aspects can be adjusted to enhance this problem for complete diagnosis. This suggests to work completely where organizations have indicators to allow us to assess completely. And also, as a suggestion, the selection processes for the personnel can help to not for people to stop or for the agreement of what is set up in the agreement. Apply prevention and control measures and to implement these securities or this committee of the social security in the work environment, and also to comply with these policies. And also monitoring our identification of risk. Sometimes we are in a crisis terms, but we have to take more corrective measures and also measure the intervention effectivity, and also to engage agencies with accreditation of systems of social and safe health systems. We have an objective evaluation from external partner just to make sure or to see what have to enhance in our sometimes we do our auto evaluation, but sometimes we cannot see what is missing. So in which work we want to get since objective vision. These are the reference, so I will be attentive for the questions that you may have. Thank you very much for the participation, and thank you for allowing me to present this information. Thank you very much, Gina, for your participation and your comments in the session. Now we will continue with our next participant or was next speaker from Dominican Republic. And then we continue with the session for questions and answers. Now I will read the curricular history for Karina Mena Fernandez. She's an economist with more than 20 years of experience in health, environmental, and public management topics. In the academic area, she works as professor at the University Autónoma de Santo Domingo, and now that she's developing a PhD thesis on the evaluation of the national pharmaceutical policy and its impact on access to medications in the Dominican Republic. She is Director of Monitoring and Supervision of Risk Management, Subsidy Control Director and Superintendency in Dominican Republic. Karina, welcome. Thank you very much. Go ahead, please. Thank you very much. I am pleased to be here on behalf of the Dominican Social Security System. I welcome here. Now we will share a little bit on how the labor market has provided their occupational risk due to the impact for the COVID. What are the challenges that we are identifying nowadays? First of all, I would like to share some general aspects from my country. We are in a short economy. For the first time in 2022, our gross domestic product goes up $115 million. The GDP per capita goes into $10,700, and the monthly index of economic activity into 4,074, and the position for the open occupational rate. We also have here informal occupational with a high level of informal occupational for 6%, who diminished in 3 months ago in October. For the same period in 2021, it was around 88%. So we can see here the graphics, so in which the process in the last years, the economic activity from the country, we have the advantage that the last decades, the economy has been growing around 5% annually. Since we have these schemes for 2013, so we already accomplished our goals. In around 4%, in tolerance range for 4%. With the impact with the COVID-19, our economic go down more than 6%. Fortunately, in 2021, not only we can recover from increase in 2020. But we also can get an increase, additional increase for the growing as in the last times. In 2022, we also have an increase in 5%. How's the empresarial system and social security system, formal system? This 76% of the productive units who gain salary for social security have less than 10 employees. So we can consider the companies that have between 11 and 50 employees. This universe can show us that around 95%, which implies that the participation for the small and medium companies is very important for the generation for the employees. What are the most important characteristics for work demand for the companies? First of all, the companies are looking for people between 25 and 45 years old. So they required experience, previous experience. 83% from the employment, they have to be university education or ethics or languages. And also we have here that 63% for work positions require a men. And also labor competencies as teamwork, communication, and responsibility. Some other characteristics here is some of the employments that have been generated have been associated for the industrial generation. And the pandemic has increased this kind of employment. If we can characterize the job offer in the Dominican Republic, they have a population that is relatively young, which we give us the opportunity to have a set of population that can make the important decisions. In terms of training, more than the half of people have intermediate training, and 1% have a PhD or master's degree. Women are shown that women have more training. 26% has gone to the university. However, in men are less than 80%. Some other more relevant aspects of the labor market bulletin from October to December 2022, the labor market of that period has increased as registered for the trimester in October from December 2019. It means before the pandemic. So we have yet to recover employments that we had before the pandemic. So the workers in economic have been has the 4,774 296 workers. The generation of work employments in the last months have been centered into women between 25 and 39 years, and in men between 40 years old, because they are all the last employments that have been recovered, and also from other countries from the region. The employment that had been recovered during the pandemic was the women sector. And also for the unemployment rate, open employment rate was in 84%. Well, occupational risk insurance, as just to understand better, has a coverage in the American system of Social Security from the Social Security Council. And they have the health system as the Minister for Public Health, and also for the labor a regulation for the minister for work minister. And the three companies interact together as the familiar sector, fiscal sector for labor risk. So what are the coverage that our occupational risk have? This is for the active workers. And now we are in the process for an implementation for a pilot process for the domestic employment. It has a accident coverage, labor accident coverage, disease or occupational disease. And also the coverage is available from the same registration from the employee. The Dominican Prevention and Prevention Occupational Risk is the administrator or the manager for this insurance. We have a species insurance or complete insurance. Also for the protection for health or the recoverage for the employees. And economic regulations, we have this capacity pensions, indemnization, or temporal discapacity. So what were the context of the war before COVID? In general terms, so they impact also the labor market, the Dominican labor market. Due to the international crisis in 2008, the flexible work model increased for increasing the structural unemployment. They imply new ways of employment to decrease the way of workers, partial work, intended work, or works without hours. And also they have been extended the use of TICs, provoking important exchanges in the nature of work, the organization, and the labor relationships. And also they have suffered from modification for labor legislations or provisions and reduction for the rights for the workers. And this flexible production model has provoked that inequality between employers and countries. So what has been the impact in the COVID within the Dominican occupational risk system? First of all, as the other countries, the unemployment are very important, especially of employment, help people or position people to work without the necessary equipment or the personnel. Also, they didn't work correctly or they were very stressed in adverse aspects. They were burnout and also psychological aspects. They were isolated in platform work. For example, home delivery also was a transition for due to the pandemic. And the pandemic continue provokes a more agile rhythm, and also has contributed to improve the city. Besides what have assured the bridge between private life and the work, what are the figures that have been registered in our market field? In the formal market, through the quotations that are paid from the Social Security before the pandemic in February 2020, we had around 2,077,000 employees in the system. And with the impact in April from this year, or May, we had a list register from around 1,534,000 employees with these problems. It means that the formal market in those weeks was less than 25% for formal employees. Fortunately, in October on 2021, we will have a recoverage for the formal employments. Our formal market system also have registered in the Social Security around 2,038,000 employees in 2023. Some other things that we had also impacted here was the salary labor salaries, was the poverty. Since we have faced an intense process for the poverty, so we have in 2013, 2003, and 2004, we have a minimum of 20% of the population in poverty conditions in general terms. And due to the effect of the COVID-19 pandemic, it increased in 23%, more than 2% Dominican percent. More than 2% Dominican people become poor. So what was the answer, or how the country faced the COVID-19 pandemic? First of all, was the articulation not only for the occupational risk system, but also familiar risk and health systems for the response that can be designed for the country. There were agreements that able to make articulation for the private companies and to guarantee the adequate treatment for people. So this allows to have a great infrastructure that was able to treat people or population who got these diseases. In April 2020, we hold agreements for the diminishing to service demand. So our administrators of health can assume or can have additional coverage that were not contemplated in our list of services. And also from the central government, we can help financially some other employees with these strategies. For example, the financial help for extraordinary coverages for the health personnel around 1 billion pesos. And also we designed some other administrative tools to help to manage the answers or the national response or the control process for the hospitals and the expense control for medications. And we also prepare a COVID rate, vulnerability rate, COVID rate for all people who suffer more or have more prevention to have more increases for these diseases. And also the most important things here that was done in terms of social security protection was in the end of 2020 for all this situation with the employment. It was decided to affiliate 2 million people to the subsidy regimen. So we had only almost 70% of the people who increased more than 80%. With this measure, we already have coverage for the 98% of percentage for the population. And also in April 2020, part of this process is to have the PCR test available for this occupational risk, where more than 2 million pesos of salaries were provided for these resources. And these resources were provided by the central government. Government finance some or provide high quality medications for the missionary attention protocol. Other of the important measures for the social protection, the suspension employees and provide some help for relatives who had not coverage. So the coverage was warranty in terms for the financial, necessary financial for this situation. So they were used more than $500,000 million for this help. As part of this process, it was acknowledged the excess of expense for personal protection and also for the intensive caregivers that was around 2,262 million pesos. There are also other coverage that present more information as tomography, some decisions for oxygen. And for this, there was created a fund for medical COVID fund that was created in 2021 that was provided more than 2,443 million pesos. And then in 2022, for the first months, 583 million pesos. One of the most important actions also here in the country was a quickly evacuation and to provide sources for the process for 2021. There was accessibility to vaccinations. And nowadays, more than 16 million doses were provided in nationwide. And that will be part of the success for the economic recovery for the country. So what are the actions that were linked from the occupational risk? There were some help of more than 14 million pesos, around $248 million, as I mentioned before, 2 million for a diagnostic test, and 12 million was used to create a solidarity fund for the employee. And for those employees who were suspended and who were unemployed, they have access to monetary transferences of less than $2,000. And also in April 2021, the COVID-19 was acknowledged as professional disease. So we allow us to articulate all the insurances. And here you can see how our poverty rate reduced and the estimations that have been made on what happened if these transferences of governmental numbers were increased. It has not been increased to 2%, but this money that was used before from the occupational risk fund helped to reduce, to balance this increase in our countries. Other important topics for the occupational risk insurance or secures was the national protocols and sectoral national protocols for security and health at work. The remote work was regulated in the country, and not only for the private sector, but also for the public governments or entities. We also we able to strengthen management systems for health and security in the companies. We have here a graph that shows the behavior for level contingencies in the last years. So you can see here that from 2020, the the phase that have to be with the COVID-19 diseases, have a decrease. That is due to the knowledge for the COVID-19 as a professional COVID-19 disease. In this, we can see here how these results have been acknowledged, or the COVID or disease have been acknowledged as COVID-19, and also as a behavior for the pandemic in the national territory. This is the behavior from during 2021, and this is one in 2022 that has been more increase in acknowledgements and occupations. And this table showed the behavior of the professional diseases acknowledged for biological agents in the last 5 years. In the last 3 years, more than 80%, it was due to the COVID-19. In 2022, and the 98% was due to the professional diseases. Here we have a short description of the financial status for our occupational risk administrator. We can see here that how the figures or the stations have been decreased due to the COVID-19 and also for the economic activities. But we already continue to progress with this behavior in the COVID-19 post-pandemic. This table shows that how are the resources and the available resources for our occupational risk insurance, even though to have used this $1,000 as a first answer for the security, we have been recovering the liquidity for this. What are the main conclusions? Definitely that our work market has been impacted for the technological development and also for integration aspects and globalization, demographic changes, and climate changes that we have been seeing nowadays, level flexibility, educative level, and some other competencies. And also we have important challenges. First of all, we have to design health and secure systems at work that can be resilient, and also as economy can show us in the last years. So we have to work and review provisions and legislation to procure and to help the integral work for the employees. We have to update all protocols and guidelines for the prevention services. We also have to continue working health at work and at home. We have to evaluate or assess the risk, emergency health risk. This is something that the COVID-19 has showed us from all these times. You have to work in inspectories to guarantee good and secure work environments, medical evaluations, and also for the salaries, and goes together with the subsequent salaries. And the tendencies for the increase of platform for workers to take in account the platform for the work for these employees, and acknowledge all the risk, psychological risk factors. We have to understand what are the challenges to strengthen social dialogue and the participation for inclusive participation that help us to review the national politica for security and health at work. This is something that nowadays the Ministry of Work are working on to be part of the development of offered of education, initial education, and superior education for the country. and create some media on prevention for occupational risk that were important to increase and enhance our development. It strengthened a process for security and health at the work to be a fundamental part or fundamental sector to minimize the impact of the crisis, the future crisis, and infections at work and environmental work. We have to make a focused prevention for all companies who make part of this productive team in national wide, not to have been a effect for these companies as an investment. But these prevention policies have to be focused to gender, age, and all the other conditions of vulnerability. Besides, we have to enhance notification systems and register for accident and labor sinistrality. We have as a goal to implement the unemployment insurance, and we also believe that with this experience, the creation of contingency funds that able to have rapid answers for these eventualities. It can be an interesting mechanism to be followed and to continue developing. Other important challenging here is to articulate the health systems and prevention services in companies from the first prevention systems to regulate and to impact in the results from the national health systems and also for the occupational risk systems. In the country, we also have other challenges for quality of work to enhance salaries, stability, and other conditions from workers. And definitely, as global level, to have an impact, there are other challenges referred to new technologies, productive processes related to nanotechnology, biotechnology, biological risk, and the artificial intelligence. And all of these have to work on it. So thank you very much for this opportunity to share our experience. Thank you very much. Thank you very much for all our speakers, Gina, Karina, and John, to share with us your perceptions and information that is very important for us. And we would like to mention, first of all, how can we see the old experiences that the speakers has presented, and also the point of views since from the diversity of conditions. For example, in some events in Peru and Colombia and Dominican Republic are shared. They share similar marking conditions. For example, the high levels of information or informality, and how it is evidence that in this session, this type of populations were the most exposed population due to the occupational risk systems, and they were able to protect employees within the informal work. And also, if we make use of these systems for the benefits are not contemplated. In the case of Canada, is very important the reflections in terms of on how the COVID-19 has been impacted the personal field. So we have to see that how the occupational risk systems can accomplish with this goal of protection in the future. The topic of transformation that are engaged in all countries for the transformation for productive relationships, how is the impact of how it affected in mental health in the return or in returning society, as mentioned before. when we eliminate the contagious risk. So we have to, for this transformation, not only for organizations in employees, but also for the people themselves. It is evidence that the use of new technologies in case of some other countries, it resulted to be accelerated because they accelerated these processes. They posed more requirements and more requirements for the employees. Also, there is the need to defer the work environments when the employees started to work from their homes. So it generates some other complications that conclude, well translated into complications. And also the differential effect for this market of the labor market, the participation of the women, as how women were affected to be higher participation in informal workers, and how they been affected in some way or due to the familiar environments they have to assume. And also this the need to understand and regulate to acknowledge that the world environment, work environment in the world has been changed drastically. We have there are many changes in the regulation of the working house, and also we have to continue working on this topic. It is also highlighting how the occupational risk systems were a support for the treatment for the states, a disposition to the state to face the pandemic, COVID-19 pandemic. And we also evidencing that some other experiences that our speakers have sharing. This topic, and don't stop here. We have the opportunity to go ahead with, to continue with this evaluation, the flexibility for systems and prepare them so they can adapt some quick provisions for other crises that can be presented in the future. Some other countries adopted measures, extraordinary measures, since the systems didn't so flexible mechanisms for adjustment. So it means that we have to work on it for the social security institutions and organizations as the CIESS to look for adjustments, modifications that can be evidence and are in need to attend other conditions, but not only for the COVID-19, but other conditions or situations of this nature. I don't want to extend or to explain more about these things, about what our speakers have been experienced or been shared. So now we can start this general dialogue from the presentation of some questions with from our participants. So we ask our guests to ask some questions related to this topic. Thank you very much. Thank you very much, Doctor. As you mentioned before, there is a series of topics in this participation of these speakers as formality, an exception of Canada, terms of remote work or technology or increase of technology use. Also, emergency subsidies that some countries implemented during the emergency, and COVID-19 establishments as a occupational disease. Similarly, that some other participants of the audience have mentioned that they goes into something similar. In this sense, I have tried to gather all the questions in these main topics. If you agree, I would like to ask a question to Ms. Anne and Gina. Since they shared the same topics or the same topics. They both already mentioned the topic of remote work and the process to the return to the on-site work. So they mentioned the positive elements of this, such as gender equity, benefits for the climate change. And also they mentioned some negative points or possible negative points for the employees as burnout or familiar conflicts and domestic violence. However, just thinking about the effects for the employees, what are the possible negative effects for the employee in the workplace if they don't take into account these recommendations that you mentioned before, Anne and Gina? And also between the recommendations that you offered before, the progressive return, what are those possible consequences or negative aspects for the employers in the workplace? Who will start first? Okay, I will start first. Thank you, Anne. Actually, the main topic that is interested for the employees' development is a negative consequence can affect the company organization and their salaries or the service they can offer. It depends on the nature of the work. The conflict between family and work or the mental health can require an attention or a cost from the company. Since they have to assign other people, other employee, just to be in charge for their task. And also there is a loss for this working team, since the working team start being integrated efforts and to start working together for the goals. They spend less time. If we talk about that, we have to train or to train someone to do these kind of topics. So we have to train this. We have to see the provision for the well-being of the employee, not only for the employee, that they will be more committed to work better in the workplace. There are also reports that there are employees who are satisfied working in their workplaces, and there are less complications on behavior or behavior from their kids. They can contribute in the familiar climate or the familiar environment, and for the company also will gain to invest into mental health from the employees in terms to have a good, effective work environment to generate good team equipment. In benefit for the organization and the workers and the general in social in the social in general.
Thank you for the question, Dr. Garcia.
Gracias por la pregunta.
That Gina said as well. I would add that employee retention right now is becoming a big issue. So particularly if I look at the knowledge-based workers, those are often the workers who can work remotely. So what we're starting to see, in fact, is one company poaching from another company because they're promising you can work from home and so on. So what's the factor that keeps someone engaged in their workplace? And I would argue it's your culture, your organization's culture. And for those who are working in a hybrid work environment where some of your employees are home on one day and some are in the office on the same day and they're trying to work together, rebuilding that culture is probably one of the best things. And of course, occupational health and safety is part of that culture. So making sure that they're equally safe at home as they are, because that's now their workplace, but we can't inspect that workplace. So we have to make sure that we're recognizing clues and symptoms from, particularly from a mental health perspective, to make sure that our employees remain safe in all its dimensions. Whether it's having the right ergonomic setup, whether it's having access to mental health supports, whether it's accommodation in Canada for, childcare responsibilities and so on. But all of that leads to a very positive workplace culture. And I would suggest that the book is being written on workplace culture as we speak in this new environment. We're trying to sort that out at our Canadian Centre for Occupational Health and Safety. And, when you go into the office, we'll have maybe 50% occupancy on high days. But if the rest of your team isn't in at the same time, it can, or the people that you work with, it's difficult to rebuild that culture. So I think focusing on that will have some very, very positive impacts, both for the employee and for the organization, and help retain those employees, so you're not into the cycle of retrain, loss, retrain, which we know is extremely, extremely expensive and very inefficient for everybody. So.
Correcto. Muchísimas gracias, Anne, por su aporte. Adelante, doctor.
Sí, yo quisiera agregar acá algo importante que hay en
I
el
will also add something important here in the forum. First of all, I would like to mention a phrase. In these topics, the number of employees are important. So there is a team, or there is a team between employers and employers. We cannot see that the benefits for the employers are not redundant for the organizations. And also, we also have other challenge in our reality, as Karina mentioned before. We have a high composition of health organizations for small and medium businesses, or sometimes micro businesses that they have a reduced capacity, as a preventive systems mechanisms that allow that this entity with less capacities can implement or develop actions for the prevention, and also for generate these organizational cultures. In general, these are entities that have less productivity and capacity. These cultures are solidarity systems that can generate effects and distribute resources. So this is very relevant, since organizational capacity to be more affordable or to face to these new requirements for a society are different, make a difference. So I think that the companies have to generate conditions that this can be effective. We have different conditions, very high different conditions. We will continue with other question from the experience that you already shared for this case for John and Karina. You mentioned some examples of some strategies that were involved due to the COVID-19 pandemic emergency. For example, a funeral subsidy as response for this risk system. So what are of those have to be maintained after the COVID-19 or the pandemic, or what other have to continue within our occupational risk systems?
Bueno, primero las damas.
No, adelante.
Adelante, Karina, por favor.
Go ahead, Karina, please. Yes, I think that pandemic has helped us to visualize some other mechanisms that can be important for the Dominican experience. They don't have a unemployment insurance, so we don't know that these monetary transference for unemployment are very necessary for all people. So they have to be institutionalized. So what I mentioned before for the contingency funds, for all this integration process in the world, we already know that the risk are more major with the climate change or the development for technology and the distances between countries. So everything can be effective or can be placed for the pandemic. So we need to have a contingent mechanisms to help to have a first reaction that can be faced. So I think that we can work on it right now. Go ahead, John, please. Okay, Dr. Emilio and I, we all share the same topic. So we have integral reform that is very debatable. The many aspects of the protection are working to include all the direct subsidies that can be unified. This is a topic, very difficult topic faced on the risk social security systems. This is an auto content unsustainable topic, so we have to enhance some other ways to guarantee this right. So the main goal here, not just to create these processes, to provide an additional regimen with the process social security coverage is a coverage for the informal occupational field. So I think that in this sense, the system itself, and as they all have said before, we have to, we all have created in the formal work, but we have to create other regimen for the informal process and also for the social protection. These are some of the main goals we have in mind. We still have. Unfortunately, we will remain some questions left, but I put the floor with the director. Thank you very much. I will welcome. I will pleased that the participants shared today because they demonstrated the disposition to participate with the CIESS and the conference in general, to be part and contribute with the sessions. Here we are trying to evaluate and evaluate these contributions in this conference as we talked before when you shared your experiences. So we have to convert this session into an informal as a talk. So the experience or the talk that we share today, this is the first name that we would like to provide for this session. So we can be able to provide to gather as friends to gather to provide experience and initiative for these sessions. The informality, not only the informality, but the freedom of analysis from certain topics, which allow us to participate together. So that is why I use this language, a colloquial language. So I think that is very useful for us. And the information you shared today is very useful for us. is useful for all participants or institution or member institutions. So we think that it can impact and have a great movement because we have main goals with differences and certain particularities. However, we have seen that these different positions, how these occupational risk systems can be dominated, and they have answered to these questions, and how they have evidenced our needs and have to continue to be adjusted and to take action before this. The future is open, is different. So we are now more open-minded, that we have different possibilities. So we have different challenges that you already mentioned before. And in the condition for the authorities of the ones who manage these systems, so we are responsible to continue from a different vision, or from a vision that can be seen positive. The COVID-19 also opened different development possibilities, and they can show new ways. So we have to take advantage from this. It goes beyond the work relationship. So it has provoked poverty conditions. So this is some of the goals that we all have to face at this direction. Thank you very much from all of us, for all of you that you have been seen or been in this session, and I will guest. Thank you very much. And this webinar, this session will be recorded and will be on your disposition in our webpage. And also we have the option or possibility to share PowerPoint presentations to all panelists. Good afternoon to all of you.